Hmm. Hello, I'm Dr. X, a doctor working here today. May I confirm your name and age, please?
Hello, doctor. My name is Thomas Harrison and I am 73 years.
Okay, may I know how may I address you?
Please call me Thomas.
Okay, Mr. Thomas, today we are going to discuss about your health issues. Is that all right?
Okay, doctor.
During our conversation, I might take down some notes, which will be strictly confidential. Is it okay?
Okay, doctor. No problem.
Well, can you please tell, Mr. Thomas, can you please tell me in your own words what have brought you here today?
Actually, doctor, this is not a new thing. This happened a few weeks ago also. That I in the morning, I sometime for about 15 minutes. I first noticed that I have some funny sensation on my right hand, and at that time I also noticed that I cannot use my hand properly. I don't get much power on my right hand, and I even couldn't pick up a pen. I thought that it was due to my bad positioning, maybe like I was sitting on the chair for that, and it will go away. But it didn't go away. It lasted for about 15 minutes. Then um, I noticed that it is somewhat becoming age, and after a few minutes, it went away. Now I don't have this problem anymore. But I am worried that if I have anything serious with it, because this is the second time I have this condition.
Yeah, I understand. I will try my level best to find out what's troubling you. May I know, Mr. Thomas, that you told that a few weeks ago you have had these symptoms again. Can you please tell me that at that time, did the problems occur in the same site in the right hand again?
Yes, doctor. That was on the right hand also, and also this type of sensation and this type of weakness. All were same at that time. But the
Always.
first episode
Okay,
lasted around, I think, maybe 10 to 15 minutes. I think a little bit shorter than this episode.
a little bit shorter. Okay. You told that it lasted for about 15 minutes. Okay, can you please tell me that did it come along suddenly or
Yes, doctor.
gradually?
Yes, doctor. All on a sudden, I was reading my newspaper in the morning, and suddenly I noticed, or I felt that there are some funny sensation on my right hand. I cannot explain what is how I felt. There was something funny, and after that, I noticed that I cannot use my hands properly. I cannot. I don't get much power on my right hand.
Okay, okay, I get it. And can you please tell me that which part of the hand was affected first? Was it the whole hand, you think, or just part of it?
Whole hand, doctor. Whole right.
Whole hand.
Yes.
Okay. Okay. And did it spread to anywhere else? Can you remember, or just the hand?
Just hand.
Okay. And can you please tell me that uh, do you have any headache? Did you have any headache at that time?
No.
Okay. Can you please tell me that what were you doing at that time?
I was reading newspaper, doctor. I was sitting on a chair
Reading
and I
and
was reading the newspaper.
okay. And can you please tell me what were you doing in the previous episode when the previous episode occurred?
At the time, I was doing some work at my garden.
Somewhat. Okay. And that's all right. And can you tell me, Mr. Thomas, that do you have any problem in vision
No,
in the time you have? Okay.
no.
Any difficulty in speech?
I
Any
think
difficulty
that
in
I had
speech?
some problem with speech that I couldn't produce much word at that time.
Okay. You couldn't produce much word. May I know that could you understand what others were telling at the time?
Yes, doctor. My wife was cooking at that time, so I just felt that, and I tried to call her and wanted to uh,
Okay,
show her that what is
but
happening.
you couldn't.
But I just couldn't. I just couldn't produce much word that I can understand, but I couldn't tell her that
Okay,
what
okay,
is
okay,
happening
okay.
with me. That
Yeah,
persisted for
yeah.
a few minutes, so I didn't pay attention to it.
Okay, and did it go away on its own?
Yes, doctor.
Okay, for how long did that persist? Both times did that occur? Both time when you felt problem with your hand,
Is this
or
problem
just
for the
this
first
time?
time? I cannot tell you exactly about the first time because I didn't
Yeah,
notice it.
that's all right.
This
That's all
this
right.
this
That's
time I noticed it.
okay. That's all right. And may I know that do you have any problem with your swallowing?
No,
Okay, well, can you please tell me that did you have any raised temperature recently?
no,
Okay, any chest infection recently?
no,
Okay, can you please tell me that do you have any neck pain?
no.
Okay, that's all right. You don't have any, okay. And can you please, okay, well, now I'm going to ask you some questions actually. Can you please tell me that do you have any soreness of your mouth,
No,
any rashes anywhere in your body,
no,
any any joint pain?
no,
Okay, any significant weight loss?
no, I haven't noticed.
Okay, any lumps and bumps anywhere in your body?
No,
Any weather preferences?
no,
Okay, any chest pain?
no.
Okay, any racing and pacing of your heart?
Yes, doctor. It is another issue that last for last couple of months, I noticed that sometimes I feel some racing and pacing of my heart that persist for a few minutes, then it's go away on its own. So I didn't pay attention to it. I just remembered as you asked this time.
Okay, that's all right. That's all right. Can you remember that whether that racing and pacing is regular or irregular?
Somewhat irregular, doctor. That I think that it is coming, going, and
Okay,
without haphazardly, without and randomly.
okay, okay. Oh, yeah. Can you remember that whether these episodes come along suddenly or gradually?
Suddenly, all on a sudden.
Okay, okay. For how long does this persist? These episodes?
I didn't count it exactly, but for a couple of minutes, maybe 5 minutes, maybe 10 minutes.
Okay, okay. Well, how frequent are those episodes? Can you please remember?
Maybe 5 to 6 times a month for last 3 to 4 months.
Okay, okay. At the time when this problem started, actually, did you had any raised temperature or any infection anywhere in your body?
No,
Okay, and were there any abnormal events in your heart or something like that at that time?
I have high blood pressure, nothing else.
O- Okay, okay. Well, okay, that's all right. And do you and okay, that's all right. And can you please tell me that do you have any shortness of breath?
No,
Okay, any swelling in your legs?
no,
Do you have to use extra pillows at night?
no,
Okay, and okay, and do you have any chest tightness or noisy chest?
no,
Any cough?
no.
Okay. May I know that what about your water work? Is it all right?
Yes, doctor.
Okay. And your bowel movement?
I haven't noticed any problem.
Okay, that's all right. You told me that you had high blood pressure. May I know that do you have any other health issues?
No,
Okay. May I know that you told that you had high blood pressure. May I know that when were you diagnosed as having high blood pressure?
about 15 years ago.
Okay. Okay. And may I know that which you are on which medication and for how long?
I am taking Ramipril and chlorothiazide. First, I was prescribed Ramipril, and about 5 years ago, the chlorothiazide was added.
Okay. Okay. And can you please remember the dose? It's not. Please don't get bothered. If you can tell.
No, doctor, I cannot remember the dose. It was.
Okay. Okay. That's all right. And may I know that are you able to maintain your drug schedule regularly?
Yes, doctor, I usually try to take those drugs regularly. Sometimes I missed a dose, but not for more than a dose.
That's all right. Has there been any recent change in your doses?
No, I haven't visited my doctor for about a few years, about maybe about 3 years.
About 3 years. Okay, okay. And may I know that? Okay, that's all right. May I know that? Have you been? Do you have any high blood sugar or anything else, or any high cholesterol levels? Do you know of any?
No,
Okay. Did you ever had any heart attack?
no,
I'm sorry to ask. Okay. And are you allergic to any medication?
no.
Any over-the-counter medication use?
Sometimes take some vitamins and minerals to keep me healthy. Nothing else.
Okay, 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 that's all right. Any herbal medication
No,
intake? I'm sorry to ask, it's a personal question, but do you? It might be unlikely, but do you take any recreational medication?
no.
Okay, I would like to ask you some other personal questions. Do you smoke?
Yes, doctor.
How many sticks for how long?
About 5 sticks per day. Previously, I smoked about one pack a day, but I have cut it down
Okay,
to 5 sticks per day only.
for how long?
Uh, 10 years.
Okay, actually, smoking is very harmful, and I would like you to stop smoking. If you want, I can refer you to smoking cessation clinic. Is that all right?
Okay, doctor.
Well, may I know, do you drink alcohol?
No,
Okay. May I know that do you drink caffeine? Do you take caffeine in excessive amounts, 4 to 5 cups or not?
you mean coffee?
Coffee, yes.
No,
Okay. Tea consumption. However, your tea consumption is it? Do you consume tea?
about 2 cups a day.
Okay, that's all right. And may I know that what do you do for a living?
I'm a retired person. Previously,
Okay. Okay.
I worked at Navy.
Okay. May I know that do you have any previous history in your any family history of heart attack or any long-term illness?
My father had heart attack when he was 68.
Okay. Any history of sudden death in your family or
No,
any death in old age?
no.
Okay, that's all right. Okay. And may I know that are you well supported economically?
Yes, doctor.
Okay. Do you drive? May I know?
No.
Okay. And did you had any
Minutes remaining.
history of travel? Any history of travel to recently to other
No,
countries? Okay. And may I know whom do you live with? Are you living alone?
no. I am living with my wife.
Okay. Well, it's a very sensitive question to ask, but may I have to ask you that have you been in any casual relationships?
No.
Okay, okay, that's all right. Well, may I know, Mr. Thomas, that what are your concerns?
Why I am having this, doctor? Is this something serious? I heard that some thing called seizure have this type of presentation.
Yeah, yeah. Well, I can get it. Well, may I ask you another question? That did you ever lose consciousness during these type of episodes?
No.
Okay. Mr. Thomas, at first, at this moment, I have to examine you properly. Then I can give you a better explanation of what has caused your troubles. But as long as I have taken history from you, it seems unlikely that you are suffering from seizures. Okay. Rather, it might be a condition named transient ischemic attacks. Okay, don't bother about the term. It can occur when some blood vessels in your brain gets narrowed. Okay, this can occur. Actually, there might be several causes behind it. One is that you have been diagnosed patient of high blood pressure, and although you are taking regular medication, you haven't been under constant supervision of your doctor. So there might be some troubles in your blood pressure now, and also you told that there had been some irregular racing and pacing of your heart, which is atrial fibrillation. Okay, this is called atrial fibrillation. This irregular pacing. Okay, at times this irregular pacing can also create some problem of narrowing or clot. Okay, in your brain. So these things can be the causes behind it, and also your smoking habit can also add to your troubles. However, we are not totally sure about it at this moment. We will involve our consultant. We will involve the nerve doctor. He might run some blood tests and also do some scan tests of your brain and also of your heart. Okay, and some electrical tracing also. After doing all these things, we can map out a plan for you, which will be better for you. Are you getting me?
Okay, doctor.
Mr. Thomas, do you have any other concerns or any other questions?
Can it lead to any serious condition, or can I die?
Okay, at this moment, well, at this moment, actually, it's a bit difficult to tell. We will actually involve the consultant and try to do the complete your investigations, actually, the tests as soon as possible. Okay, and after doing the test, we can be more sure about it, whether it's very harmful or not. But yes, I have to be truthful that these troubles can cause some greater problems later on. It's truth. It's true. Okay, so it's better that you have modify a bit of your lifestyle also, and also you reduce your smoking. Okay, and make some good control of your high blood pressure. All these are needed. Okay, are you getting me? Are you with me, Mr. Thomas?
Okay, doctor.
Any other concerns?
No,
Okay, so thank you, Mr. Thomas.
thank you. What is your diagnosis?
Well, I think the patient is suffering from transient ischemic attack, and the cause may be atrial fibrillation due to hypertensive cardiomyopathy. Might since he has not been under regular checkup, this atrial fibrillation might have been the cause of his symptoms of this transient ischemic attack.
Cannot atrial fibrillation be idiopathic?
Atrial fibrillation, yes, it can be lone atrial fibrillation. It can be idiopathic.
How will you manage him?
Okay. First of all, I will have to, since he has been there has been a few weeks time lapse, not in the same week, a few weeks time lapse between these symptoms. So at first I will make an call so that he has a specialist review within a week, and at the same time I will give him some blood thinning agents like aspirin and clopidogrel, and also I would like to have some duplex study, so that duplex study of his carotids, so that whether he is eligible for carotid endarterectomy or not, that can be ruled out by the specialist doctor. And of course I will have to involve the cardiologist and a neurologist in this case. And also I have to again look into his high blood pressure, hypertension, what medications are he getting, and whether the dose is appropriate or not, and also look into his cholesterol level and blood sugar level, whether any preventive simvastatin or other statins can be given or should be given. And I think it should be given regarding his age and risk considered.
What investigation you need?
Okay, first of all, I have to run some routine blood tests like CBC, ESR, CRP, then serum urea, electrolytes, and creatinine, and serum lipid profiles, blood glucose level, HbA1c, and then I have to go for some scanning tests like echo of heart and also CT scan of a brain. And then also, if the consultant persuades, then we might go for diffusion weight MRI of the brain also. And then we also have to do some ECG tracing, okay, because of his irregular heartbeat. And also we have to go for the carotid duplex study, I think. And these are, I think, the primary concerns. And also I have to check the INR level, whether for when any warfarin can be given or not.
Okay.
Okay.
In the history taking, I think your history taking was fine. Just one thing that which hand was affected, which part was affected, any other part affected. What about the other hand? What about the leg?
Mm.
Onset sudden or gradual? any have anything abnormal before the onset, like any
Mm-hmm.
changes in the vision, any palpitation,
Mm-hmm.
or any headache before the onset, and during the onset, did you notice any shakiness, any pain,
Mm-hmm.
any
Before starting, any warning shots? I should have asked that, no? Any
yeah,
warning shots present or not?
and
Mm.
during any pain and
Mm.
weakness,
Mm.
how severe was the weakness?
Mm-hmm.
Any
Mm.
any changes in the color,
Mm. Mm.
then any
Mm.
other sensory abnormalities.
Mm-hmm. Mm-hmm.
And after
And
that,
after how long? Oh, how long? How was he? Was he confused or not? No.
and during that also any palpitation, any other shakiness, any parts of his body, any loss of
Mm-hmm.
consciousness.
Mm-hmm.
After that,
Actually, I forgot to ask loss of consciousness. I asked it later on. Okay.
was there any after effect, any drowsiness,
Yeah. Yeah.
or any weakness, any sensory sense?
Yeah.
Was
Yeah.
both sensory sense and motor sense went simultaneously, or one went after another?
Mm-hmm.
Did he notice anything brings that episode, or did he notice that
Mm-hmm.
age this episode and also severity? And after that, history taking, that was fine. Fine. Weight sense, I cannot remember if you have asked weight sense.
I asked. I asked.
Okay.
Okay.
And also in the history taking, in the you went for the personal history first, then you obtained for family history.
Yeah. Yeah. I just missed that. I could remember. I could reckon that I had made a mistake just at that time.
And for hypertension, does he go to his eye doctor, kidney doctor, heart doctor? Is
Yeah.
there
Yeah.
any
Yeah.
complication for
Mm.
that?
Mm. Mm.
And otherwise, this was fine. And in the management, when talking to the examiner, always use the medical terms, not blood thinning agent. You can't say exactly that I'm going for
Yeah.
anticoagulation.
Yeah.
First, go for the
Mm.
management plan. When he is asking about management plan, go
Mm.
as a it is written in the book, like it needs a multidisciplinary approach,
Mm. Mm.
involvement of
Mm.
cardiologist for his management of blood pressure and also management of his atrial
Mm.
fibrillation. And for atrial
Mm.
fibrillation, I also may need for anticoagulation. Then review
Mm. Mm.
neurology, review on the neurology restore outpatient stroke clinic
Mm. Mm.
for better evaluation.
Mm. Mm.
And
Okay.
so
Okay.
he needs smoking cessation clinic support.
Okay. Mm. Yeah. Well, I told about that duplex scan, was that all right? Carotid and endarterectomy is visible or not?
Okay, there are a lot of investigations needed for this patient. ECG, echocardiogram, 24-hour ECG
Mm.
monitoring, or even event recorder
Mm.
monitoring,
Mm. Mm.
and also
Mm.
carotid study
Mm.
in other studies like blood or other studies like blood cholesterol, etc. Many lot of
Mm. Mm. Okay.
for this symptom.
Okay.
Okay, it is fine.
So, what was the case actually? Due to atrial fibrillation?
Yes, transient ischemic attack. Most underlying cause is due to atrial fibrillation. The atrial fibrillation can be due to low atrial fibrillation, as high uncontrolled blood pressure that can cause also, and also he
Okay. Uncontrolled blood pressure and atrial fibrillation, no?
yes, uncontrolled BP and low atrial fibrillation. That is another cause.
Okay. Okay. So I think that's all right.
Any nausea, vomiting? I cannot remember if you have asked it or not.
No, I didn't ask.
There's some electrolyte imbalance, sometimes electrolyte imbalance, and also with this patient, some warning or red flag sign. I cannot remember if you have asked for that. Any morning headache, any weight
Hmm.
loss, any changes
So
in
weight loss I asked.
any changes,
Changes in vision I asked.
any focal weakness or weakness any side of his body.
Hmm. Hmm.
Okay,
Okay.
fine.
Okay. Okay.